What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we'll be talking about the X-ray field and how occasionally we'll see that some people, it's kind of, if you don't enjoy like the other modalities, or it's kind of like, from what I've seen, most people, not a dead end job, but like you just get so comfortable in the same routine. And I see that with a lot of people. Like they don't want to pursue more, they want to do more outside of, their X-ray career, which some people, I understand. You work so hard to get your X-ray degree. You're just like, okay, I got it. It was hard to get it for some people like me. You don't want to do more. You don't want to, pursue other avenues of revenue or other, do more, I guess. I've seen that a lot amongst some of the older techs. You just kind of get complacent and just, you don't innovate as much, I would say. I mean, my job's pretty good. I ain't gonna lie to you. Like, I go to work, and sometimes we'll be there. I work graveyard shift, as you can see. We're going to go to work 7 to 7. 8 to 8, 7 on, 7 off. And there'll be some nights where we'll be so chill, getting paid money, and I'm like, what more do I want? Like, this job's so easy sometimes, and I'm like, I don't even want to do anything else. But then a part of me is like, no, Miguel, you just have to enjoy the moment, enjoy that you worked hard and you got here, and then you have to see what other adventures or other stuff you can do to hopefully, up your game, make more money, find ways to, get in a higher position to do more, I guess. Like, I'm trying to do this. This is more of a, not much for revenue and money and stuff like that. Because I mean, if it does, it'll be nice. I'm just trying to give back and inform people of the X-ray and what can be done. But there's other stuff that I don't talk about that hopefully will come into play in the future and level up, and then maybe with time this X-ray will be a PRN or part-time position, and I'll just be mainly focused on the other stuff. Because I personally respect everyone who chose to do X-rays and then continue on to do CT, MRI, or other modalities, or even became a radiologist themselves or an RPA. Mad respect to you. It's a lot of work. They work you hard, and that's part of me that doesn't want to pursue those modalities. And me personally, I feel like the amount, especially where I work, the amount of stress and worry and liability you have for the compensation you get, I feel that is not there. Or even if the pay was the same, but if they had more people and they were more staffed, it would maybe be considerable. But no, because there's a lot of people who go to work and they're all stressed and stuff. Living literally stress-free every day. I don't really worry about many things at work. Except little things like if the portable she's working. So I can see why people will be complacent or stagnant, and I kind of feel, especially when you find a good job and you're happy and you have decent benefits. Maybe the pay could be a little better, but some of these nights we don't do nothing all nights. I can't really complain. Those nights, and then there's other nights you work hard. Because I feel like even if you just decide to do this field, I've only been here a year and a half, almost 2 years, and I have innovated at this job so much. I'll do a video in the future. And most of the techs who's been there 10, 15, even 20 years are mind blown by this stuff. I'll be coming up to innovate, to make my job easier, more efficient. For the patients, of course, for the patients. For the patient care, it's all for the patients, never for us, But they'll be mind blown, and it'll be simple things. And they'll just be just astonished and thinking I'm an engineer or something crazy, and I'm like, it's not that hard. Or maybe I'm just a special peanut in the bunch who just sees stuff differently, or maybe it's because of my ethnicity and how I was raised and how it's always been work harder, work smarter, find ways to improve at your job or whatever you're doing to be more efficient, be better, to end goal, get more money, more promotion, more stuff like that, I guess. Because there are certain little things that I thought of that everyone complains about, but never does anything. Never does anything. And always at my job, I always kid around. I'm like, well, if no one does it, I guess I'm gonna have to do it. If the company doesn't do it, I guess I'll use the resources, or let me say, some of the income they gave me and put aside towards some of these innovations. Because if I don't do it, the company won't. And then some of the stuff I've come up with, some of the day shift or the other crew will kind of envy a little bit and wish that I leave the material or the product with them during the day. And I'm like, well, I mean, you can go buy it yourself and do it yourself, but once again, they don't want to. And I'm like, well, it's not fair for me who does this, because every time I leave stuff there, they always end up, like, I'll come the next day and then it won't be there. Like, my stuff isn't there. And I can never, get, if I leave, something as simple as, I have a little door stop that I put, because the door at night is less staff. We don't have people to help us, and we'll bring a patient back. If my little door stop literally will disappear the next day. A little door stop. It costs 50 cents, granted, but it makes me mad that even when I forget stuff, most of the time I'm like, please be there. And that's never there. So half the time, stuff will go missing. So, but I'll make another video on that to show you guys that some of the stuff I've done to innovate and hopefully help y'all out too. There's some simple ones, like you can, I'll give you one right now. So the stuff you clean your Xray boards with usually comes in a little jug, little container like this, and it has the little wipes. So usually what ends up happening is you'll go, especially if you're by yourself, and you'll try to pull one. So you open the lid and then you pull one out. Usually you have the Xray cassette on the other hand, so it's kind of a one type. So when you pull it, and if you keep on pulling it, well, you're gonna get a whole string. So you have to clamp the thing down and then pull it. So I figured out, if you grab a rubber band, make sure it's not the jumbos but the medium size, and you wrap it around the little thing, like the little container where the lid is, so when you open it and you pull a little bit, it will clamp down on the little tissue you pull out, and that will literally save you from fighting that thing. That's something simple, literally what, a penny worth of stuff, and no one has ever thought about that at where I work. Simple things like that to make your job easier. There's other stuff that helps way more in the field, which I'll go in depth in another video. It's been your boy Miguel. Hope you enjoy your daily dose of radiation. See you on the next one.